Welcome to today's video on the fat dissolving injections, and we'll be talking about everything that you've got to do with fat dissolving injections, from different products, product placement, treatment protocols, complications and contraindications. So let's get to it. Now we're going to start off with skin anatomy and physiology, and why is that important is we need to know into what layer of the skin we're actually going to be working on, and depending on what layer you're working on, that will determine your needle depth and the type of the needle you're going to be using as well. So as you know, 3 different layers of the skin. You have the epidermis, dermis and the hypodermis, or also called the subcutaneous layer. Now each individual layer, as you know, has its own function. You have the top layer, the epidermis, which has a very protective type of function, and has sub-layers within itself as well. Then you also have the dermis, so quite a few important things in the dermis. You have your collagen, your elastin, hair follicles, nerve endings, sweat glands, quite a few things in the dermis. And then right underneath is what you find is the hypodermis, or the subcutaneous layer, where you naturally store all of your fat cells. Now when it comes to fat dissolving injections, the layer that we're actually targeting and we're very concerned about is the subcutaneous layer, because we're targeting the actual fat cells. And with that being said, you don't want to target the layers that are more superficial, so the epidermis or the dermis, or target anything going under the subcutaneous, which is the muscle tissue. So make sure that you are in the right layer of the skin, as the actual treatment is very targeted towards the fat cell. And whenever you're in the wrong layer of the skin, that's when you actually get all the complications that can potentially arise from the treatment. Now when it comes to different body fat, you have your subcutaneous layer, where you naturally store all of your fat, and that is called subcutaneous fat. Now this type of fat is one of the most common one, and you can feel it sometimes. If you just roll the skin, you can feel like little bubbles. Now what you're feeling is the actual subcutaneous fat, which is right where the subcutaneous layer is. And then you also have something called visceral fat. Now this is a type of fat that it's your fat cells that have hardened over time, and whenever you touch it, it's really hard to touch, and it's actually located underneath your subcutaneous layer, right in between your subcutaneous layer and your muscle tissue, and that is the visceral fat. Now when it comes to the actual fat cells, are also called adipocytes. Why is it important that we're looking into this? Is really important to know the actual fat cell, to then understand how the fat dissolving injections actually work, and what results and how they're going to happen when it comes to your clients. Now adipocytes, again, where are they located? Is the subcutaneous layer of the skin, and the main functions of the fat cells in general is the energy storage. Now as you know, whenever you exercise, you are releasing energy from your fat cell, as the functions of the fat cell is to actually store energy. And then another function is actually insulation, as well as heat production. So that's got something to do with just controlling your body temperature. So for example, if outside is really cold, you'll start releasing energy from the fat cells, and the fat cell itself will actually increase your body heat to then protect you from the really extreme cold temperatures. So that's got to do with the insulations as well as the heat production. So it's basically protecting you from the environment. And then you also have cushioning. So cushioning is protecting your muscle tissue, protecting vital organs from any external damage. And that is because the actual subcutaneous layer is right in between your top layers of the skin and the vital muscle tissues and the organs. So it acts like a little cushion to protect anything vital. And you also have hormone production. Now, for example, there's a few vitamins. Let's say vitamin D. Vitamin D is a fat-soluble vitamin, meaning that it's stored within the fat cell. So with that being said, the fat cells are actually responsible for hormone production as well, specifically for vitamins and the hormones that are, stored in the fat cell. And why did I mention vitamin D? Is because vitamin D is stored in the fat cell and is also very essential for hormonal production. Now, these are some of the functions of the fat cells in general. Now, when it comes to the actual cell and it's what it's made out of, then you can see the major part of the cell is actually the fat reservoir. Now, this is where you naturally store the fat within the cell. Then you have the cytoplasm, mitochondria, Golgi apparatus. These are all different organelles that makes the cell function as a whole. And then you have the nucleus, which is it's basically the heart of the actual cell. Now, the one thing that we're going to be looking into the most is the actual membrane of the fat cell. Now, the membrane is the surrounding of the cell, and it's like a layer all across the fat cell that keeps it in one place. And why are we so concerned about this is what we're actually targeting with the fat dissolving injections is that specific membrane. We are trying to destroy the membrane. So then when there is nothing holding the actual fat cell in place, the cell will just burst and it will turn into liquid. So everything that's within the cell will essentially liquidify. And that is by targeting the membrane and destroying it effectively. Now, how do fat dissolving injections actually work? So we did just touch up on that, and basically the fat dissolving injections are designed to break down the fat cells by actually destroying the existing membrane. And when there's no membrane, the fat cell just turns into liquid. Now, when it turns into liquid, what you do is naturally flush it out through your lymphatic system. Now, the lymphatic systems here is really important, and as you can see, you have three main points when it comes to lymphatic drainage. Now, you have lymph nodes all over your body, but these are your three main ones. And why do you need to know that is whenever you are doing a specific area of fat dissolving, you would always need to consider where the main lymphatic nodes are, as to that's the actual place as to where your fat cells would actually have to flush out through. So for example, you have these cervical lymph nodes. These are right as to where your neck is. So for example, if your client has had the chin done with the fat dissolving solution, they would need to do a lymphatic drainage massage towards the cervical lymph nodes. And that's the same as the axillary lymph nodes. So these are right underneath the armpit. So anyone that has done the underarms done or the arms done, then they would need to massage in a way that they're flushing out the destroyed fat cell towards the axillary lymph nodes. And then the other one is the inguinal lymph nodes, which are just where the hips are, where the groin is. So in case anyone is doing the love handles or the stomach, they need to be effectively carrying out the lymphatic drainage massage towards those lymph nodes. And with that being said, areas that are actually very tricky to treat with fat dissolving injections based on the flushing they need to do through the lymphatic system. This is anything below the torso. So things like thighs or knees, ankles. Now, they don't actually have any they have no passage as to where they can actually flush. And why is that a problem? Is that if you consider doing someone's knees and then breaking down the fat cell and turning it into liquid, now that liquid will start moving, but gravity will naturally pull the liquid down towards the feet. And that's a problem due to the fact that the client might experience swelling, redness, tenderness, pain, because the actual fat cell is not able to flush as there are no lymph nodes around those areas and no major points. So from the torso down, very careful as to areas that the client is actually asking you to do. The only area I would probably do below the torso would be the inner thigh, as that is the closest one to the inguinal lymph nodes, and it has an easier way to flush. But the problem with any other area is that it has no other flushing point, it's not close to the lymph nodes, and it would not give you any results but just pain and swelling and tenderness. Now, treatment areas that you can actually target, I would say pretty much any area that does have fat. So the ones that are really, really common is the double chin, gives a really great result. Then you have the arms, the stomach, and the love handles. These are your main ones that you will see with clients that are the most requested ones. You can also treat inner thighs, arms, back rows, and the axillary fat. And depending again on what area you're treating, you would need to tell your client what's the correct way to actually perform the lymphatic drainage massage. Now, as you can see, the only thing that's below the torso that we're doing is the inner thigh. So anyone asking you for back of the legs, side of the legs, knees, ankles, it's a big no-no, just because it can't actually flush, and the client would just experience a lot of pain and no visible result. Now, if you do choose to treat inner thighs, the client needs to be aware that they have to be very religious with the massaging. So they have to lift their legs up. The reason why they're lifting the legs up is just allowing all of the fat cells that have now been broken down to go down towards the actual lymph nodes, and that is to flush them out. Otherwise, again, the same issue is that with gravity, everything will just go and travel down to the knees and the ankles. When it comes to treating the double chin, we need to consider the facial fat pads. Now, there's a high risk area here. You have the actual upper cheek and you have the neck. So the neck, it's a high risk area, quite a lot of arteries there, it's quite bony, so I would not touch that unless, as you can see on the third lady on the right, you can go a little bit lower, just because you're not actually going to be affecting the neck, you are just going to be targeting the subcutaneous layer in that case. However, on the lady that's on the left, the first lady, I wouldn't go into the neck because she just doesn't need it. So always judge it by what you see with your clients. Now, when it comes to the cheeks, nothing from the corner of the mouth upwards. So that is your cutoff point as to how high up you can go with your fat dissolving injections. Now, the injections are great for redefining the jawline, getting rid of fat pockets around the jawline, or jowling as well. So that's something that you might see with some clients too. And you can, with that one, inject a little bit higher above the bone on the jawline, but as long as you're following the corner of the mouth and not going higher than that, that is perfectly fine. The actual cheeks you cannot touch. It's a very high risk area. It's really close to the eyes. You could do some damage. So just make sure that you are working within the parameters. And again, always judge it by the client that you can see in front of you, what's their concern, where is the worst part of the area, and that will determine also where you're going to inject and then how much product you're going to inject as well. Now, going into products, and for this you have plenty of products. Some of them are different, some of them are very similar, and the three main ones that you might have heard of and you might have tried and seen, these are Aqualax, Sinciller, and then Lemon Bottle. Now keep in mind, on the market you have more products than that. You have Diesel Face and Diesel Body, you have Lipolab, you have Pine Bottle. There's a lot of products. However, these are the top three ones that we're going to run you through, as these are the top three that the clients really do request, and you might experience an in demand for those products. And again, all of those products do exactly the same when it comes to destroying the fat cell. They destroy the membrane and then turns into liquid, and then you flush it out. The process is always exactly the same. The difference is as to how the actual product does that, and that is completely determined by the ingredients of the product. As you can see here, you have Aqualax, that's the first one. Now, Aqualax is one of the first fat dissolving products to actually come out on the market, which is why even until recent days, clients are still asking for it, clients are still requesting it. However, in terms of giving the results and being really effective, yes, it is still effective. However, products have really massively improved quite a lot. So Aqualax nowadays isn't really that widely used due to the fact that it's a little bit outdated now. But still, some people might request you for Aqualax, so we're going to run you through this one. Now, the main ingredients of Aqualax is deoxycholic acid. Now, deoxycholic acid is a naturally occurring acid within your body, which you will find within your stomach. It's basically your stomach acid, which is what deoxycholic acid is. So anyone having any reactions to that one is very, very unlikely, because you can already find it within the body. Now, the acid itself is the one that actually destroys the membrane of the fat cell and turns it into liquid. Now, Aqualux, just remember this, is an acid-based type of product, and the acid by itself just destroys the membrane of the fat cell and again turns into liquid, and then you flush it through your lymphatic system. And other ingredients, you have buffer system, you have sugars inside of that as well, so nothing really to be allergic to when it comes to Aqualux. Something very specific with Aqualux is that it does not have a tightening effect and also causes a lot of swelling, so that's something that your clients really need to be mindful of. And the swelling is not a side effect. What the swelling actually is when the product breaks down the fat cell and turns into liquid, that same liquid occurs and is visibly seen as swelling. Sometimes clients get really worried and they think they're having a reaction. It's not a reaction, it's literally your fat cell being broken down into liquid. But because Aqualux has no tightening effect, you can really see the swelling straight after the treatment. Nothing to worry about. After massaging and doing lymphatic drainage, the swelling goes away, but probably next 7 to 10 days it will gradually go away and flush out. Now, another thing with Aqualux is that it is actually very painful when injected on its own. So if you just take the vial and you put it in the syringe and you inject it straight away like this, it has a really painful burning sensation for the client, and it's really uncomfortable. So if you ever choose to use Aqualux, you do need to mix the product itself with liquid lidocaine. Now, lidocaine would actually make the product itself not as painful, as lidocaine is a numbing agent. So if you ever choose to mix it with lidocaine, the ratio is about a 1 to 10. So if you are using a 10 ml syringe, you mix a 1 ml lidocaine with 9 ml Aqualux. If you're using a 5 ml syringe, you would do a 0.5 lidocaine with a 4.5 Aqualux. And then again, you will put on the numbing topical cream on top and inject. However, if you don't mix it with lidocaine within the syringe, it's unfortunately extremely painful to the client. With Aqualux as well, it limits you to 40 milliliters of product usage per treatment per person. Now, what does that mean? Sometimes clients will come to you and say, I want to get my stomach done, and my arms, and my chin, and my legs. Now, they want quite a few areas done, and when it says maximum usage, that means that on one treatment, on one person, you can only do a maximum of 40 milliliters, not over that. So if she comes to you and says that she wants a lot of areas, all you have to think about is that you have 40 milliliters to work with and spread them across on different areas. Now, this is where you need to consider how much of a product an area actually needs. Let's say doing fat dissolving in the chin is roughly about 10 milliliters, and doing the stomach on average is about 20 to 30 milliliters. So that on average, someone choosing to do the stomach and the chin is about 40-50 milliliters even. So that's when you have to tell to the client that they need to prioritize where, they have to choose in between what areas they need to target first. And really important to not go over the 40 milliliter limit, as if you do, the client can get quite overwhelmed, they can feel a little bit nauseous, and it's not a great feeling because it can actually increase the acidity within the body itself, as the product is again acid based. So that's why you have a limit on how much you can actually use. Now, when it comes to the injection points, you have a 0.5 ml product to be injected on each injection point. And as I will show you later, you're actually going to create like a little map on each different area that you're going to treat, and you're going to create little squares. Now each individual square is each individual injection point, and on each injection point you're going to inject the exact same amount of product each time. And why do you do that? Is the reason being is you need to inject equal amounts of product on each individual spot to make sure that the product is distributed evenly everywhere. And if it's not distributed evenly, you can get bumps and dips and, you know, uneven results, which is the reason why we have a specific amount of injection product on each spot. And this is also the reason why we do mapping on the actual areas. So just remember, Aqualux, each injection point is a 0.5, not more, not less. And then for aftercare advice, you cannot actually exercise for 2 weeks after carrying out the Aqualux treatment. This is due to the fact that the Aqualux is acid-based, and the acid itself needs a little bit more time to actually work and break the fat cell. So anyone that wants to do the Aqualux treatment, you need to tell them beforehand that they cannot exercise for 2 weeks post-treatment. And then massaging the area after 72 hours. Do not touch the area, do not rub, scrub, don't do anything. Only start massaging after 72 hours, and this is when you are performing the lymphatic drainage massage. Nothing before that, because if you do it before, you're actually going to end up moving the product around. So only after 72 hours you need to give the product time to actually break down the fat cell. And then the needle you're using is a 27 gauge 13 mm. I wouldn't use a thinner needle than this because then the product is really hard to come out. I would not use a bigger needle than this because then the product really leaks quite a bit because it's very watery. If you use a shorter needle, you will not effectively reach the right layer. If you're using a longer needle, then you're going to be too deep. So this is the best needle that you can use for any type of fat dissolving product, really. And then the treatment frequency for Aqualux specifically would be every 4 weeks. Now keep in mind, if you're doing chin and you've only done about 10 milliliters product and it's a relatively small type of area, you can repeat the treatment every 2 weeks. However, if you have done a body area and you have injected quite a bit of product, about every 4 weeks is the average as to what you will want to do with the Aqualux. And again, you will see each individual product, each individual brand will have its own parameters, its own treatment frequency. And again, this is all based on the actual ingredients that you get within the product itself. Now to move on to Sincilla. Now Sincilla is, again, it's a deoxycholic acid based product. However, what makes it different to Aqualux is that it contains carnitine and vitamin B2. Because of those 2 extra ingredients, Sincilla is considered a lot more natural in terms of what it has inside, and also has a tightening effect. Now carnitine and vitamin B2, both of these work on the actual metabolism and the energy release from the fat cell, and also have a skin tightening effect when injected. Now because of the tightening effect, the Sincilla actually does not have any swelling after the treatment. And you know, in comparison to Aqualux, Aqualux has a lot of swelling because it does not have, you know, the included vitamin B2 and the carnitine, while Sincilla does. So it does have a tightening effect, there's no swelling. And also, this is the only product that is entirely not painful at all. You don't have to mix it with anything, just draw it out into the syringe, inject it straight away, and there is literally no sensations from the product itself whatsoever. And in comparison to Aqualux, the actual percentage of the deoxycholic acid is a lot higher, so it's a stronger product. So as you can see, it's quite limited as to how much you can use per treatment. So the maximum usage that is given by the manufacturer from Sincilla is 16 ml per treatment. Now each vial is 8 ml, so the maximum you can use per treatment is 2 vials. Now this is where you really have to have that consultation with your client in order to let them know that you have to probably prioritize as to what treatment area they need to get done. And again, 16 ml is your maximum, and then each injection point is a 0.3 milliliter. So you see a lot less than Aqualux. Reason being, it's got a higher percentage acid, and it's a lot more stronger in comparison to Aqualux, so you can't inject a really high amount of the product, as that will really increase the acidity of the body. So it limits you to a 0.3 on each injection point. Pretty much the same for Sensella when it comes to the aftercare. No exercise for 2 weeks, and then only massage the area after 72 hours. And again, if you're doing chin, that can be done every 2 weeks because it's a small area. If you're doing body, that would be every 4 weeks. Now, Sensilla it's a great product, and you know, in comparison to Aqualux, Aqualux is quite outdated nowadays, just because there's all that pain, there's all that swelling, there's no tightening. So a best choice out of the two is definitely Sensilla. And now lemon bottle, as you can see, it's a little bit different in terms of ingredients in comparison to the other two products, and this is why this is one of the main reasons as to why lemon bottle has been so popular nowadays with clients and practitioners that have been using it. So lemon bottle, the main ingredients that you will find is bromelain, lecithin, and vitamin B2. Now these are proteins and enzymes. So bromelain is actually derived from pineapple, lecithin is from wheat. So the reason why it's so popular is it works in a slightly different way in comparison to the other acid-based products. Now, any acid-based product will actually use the acid itself to break the membrane on the actual fat cell and then turn it into liquid. Now, lemon bottle, the enzymes and the proteins, what it would actually do is trigger the metabolism, and what it would do is it would increase the energy release from the fat cell itself. Now, when the fat cell starts doing that, it would start attracting water to itself, and to the point where it would have attracted so much water and it would simply just burst and the membrane would be completely destroyed. And when the membrane is destroyed again, you're just going to flush that through your lymphatic system. Now, what's great about lemon bottle is because it doesn't use any acid, you can use a lot of the products. So you can see the limit is about 50 ml per treatment. And you can also exercise after 48 hours. The exercise doesn't interfere in any way. It's actually beneficial because you're working on the energy release, and exercise would even increase the energy release through the lemon bottle as well. Has a tightening effect, and this is because it contains vitamin B2 and also doesn't cause any swelling. It is not painful, however you do feel a slight stinging kind of sensation when the product is being injected, but would definitely not say it's painful. And again, the maximum you can use is 50 ml per treatment. I would not go over that just because again the client might feel a little bit overwhelmed that from the product and the sheer amount of how much you have injected, as it's a lot to actually process. And then each injection point is a minimum of 1 ml. Now with lemon bottle, because there's no acid, you do have to inject quite a bit of the product to actually affect the fat cell itself. So make sure you're injecting at least 1 ml in each injection point. No exercise for 48 hours and then massaging the areas after 48 hours. So again, this is one of the main reasons why people actually love this product, is because it doesn't limit them when it comes to exercise. So it's quite flexible in terms of the aftercare. And then the treatment frequency as well, you can carry out quite frequent in between sessions. So for example, if you're doing the chin, your sessions can be every 7 to 10 days. And when it comes to body, you probably want to leave about 10 to 14 days to really allow the fat cells to flush entirely. So that's not a good thing about lemon bottle, is the actual frequency as to how you can carry out the treatment. And this is all due to the fact that it's not an acid-based type of product. Now when it comes to the actual technique, this is pretty straightforward when it comes to fat dissolving injections, and it's one of the safest techniques that you can actually use to carry out the treatment. So one of the main things is to actually pinch the skin as to where you're going to inject. The reason why you're pinching is whenever you pinch the skin and you kind of pull it up from the muscle tissue, and the only thing you actually be holding within your fingertips when you're pinching is the skin and the subcutaneous layer with the fat cells. So whenever you push the needle through, the only thing you're going to be targeting is the fat cell. You're going to be really far away from any muscle tissue, from any organs, due to the fact that you are actually pinching. So you're effectively only targeting the subcutaneous layer. Now the problem is whenever you are not pinching the skin and you're just pushing the needle in, you're just going in blindly into the skin, so you can end up injecting too superficially, you can end up injecting too deep into a muscle tissue, for example, and that's exactly when you actually get complications coming from the fat dissolving injection. So again, just pinching, inserting the needle, and for this you're going to inject at a 90-degree angle to specifically target the fat cell in that specific area that you're injecting. So as long as you pinch and you inject at 90 degree, you are perfectly safe. Now, fat dissolving injections mapping, we're going to run through different areas, and we're going to start off with the double chin, and I will show you different variants as to how you actually do this, and this is always dependent on the client. Now, for example, for this client, her main areas of concern are under the chin and also the side of the jawline. So as you can see, we're targeting the fat pocket that's right underneath the chin and going across towards the ears and the jawline. Just make sure that you do make your clients aware that it does take a few sessions. For example, on average for the double chin is about 3 sessions, and they do need to be aware that it's not a one-off type of treatment. You do need to follow up with a few more sessions to really get your desired results. Now in this case, as you can see, we have created a little map with a few squares, and what the squares indicate is each square is basically each injection point. So for this lady, let's say for example, you're going to do in between 10 to 12 milliliters if you're using lemon bottle. As each square, you would need to inject a 1 ml of product. Now moving on to this lady, as you can see, the actual map that we have created for her is a lot different in comparison to the first lady that we've seen. Now, as you can see, in this lady's case, we are concerned about the fat pocket that's right under the chin, but we're also looking at the jowling that she has from the aging process. Now, this is the case as to where you can actually inject higher up from the bone on the jawline, and you can see we're actually cutting it off right where the corner of the mouth is. So essentially, not to go higher than this is your cut-off point as to how high you can go. And you can see going towards the end of the jawline, we're only doing about 1 injection point on each side. This is because she just doesn't have that much fat going towards the end of the jawline, so you wouldn't need to inject that much product. So we're really concentrating the product as to where the main areas of concern are, which is right under the chin and also right where the corners of the mouth is, so where the jowls are appearing. You can effectively dissolve the fat that's in the jowl, and also have a tightening effect as well around that area. Now moving on to abdomen. Now this is one of the other most popular areas that clients will ask you for. Now as you can see, when it comes to the abdomen, you're following the outlines to find the actual fat pocket as to where you're going to be working on. And you're just creating the same exact map, and each square again will be an individual injection point. And you can see we're actually staying away from the belly button. You cannot inject into the belly button, so you're just going to work around it. And each square should be around a centimeter diameter on each side. So make sure that you don't have really small squares and then really large ones, because then your product would not be distributed evenly. And when it comes to treating any body part, really 4 to 5 sessions are required on average. So that's another thing that you need to tell your client to do. And when you're treating the abdomen, whenever you're doing the aftercare advice and showing the client how they need to massage, you also need to consider the lymph nodes. So you need to be pushing down towards the groin in order to actually effectively flush the fat cell. Then whenever you do the arms, make sure that whenever you do the actual map, the client has their arms raised up. And what you see is when the arm is raised up, they will have the bone and the muscle stay on top, and right underneath is where you have all the fat. Now just create your map, create your outline, draw your little squares. And again, for any body part, your average amount of session would be about 4 to 5. And then moving on to inner thighs. Now for the thighs, make sure that you're only targeting the inner side of the thigh. You're not going to the top, you're not going at the back of the thigh, because the problem with that is the flushing. The only thing that you can do on the legs is the inner thigh. I wouldn't really touch any other area. And again, with this, just follow as to where you can see that the fat pocket is, and create your outline and your mapping that way. And just make sure that you're not going too high up on the actual top of the leg, and you're not going too far behind on the back of the leg, because the client would actually struggle with flushing out the fat cell after that. And again, when it comes to flushing, when it comes to inner thighs, they need to make sure that they're raising their legs up and they are pushing it down towards the inguinal lymph nodes in order to actually flush the fat cell from the inner thigh. Then doing back rows, as you can see again, we are just following the creasing and the outline as to where the fat pockets are. And just create your map, make sure that your squares are all evened out, and that's the same, 4 to 5 sessions required. And then we need to be pushing this down towards the stomach, and then pushing it down towards the groin in order to actually be able to flush the fat cells out. Now going into contraindications for fat dissolving. Obviously pregnancy and breastfeeding, you cannot do anyone that's currently pregnant or breastfeeding. They would need to at least stop breastfeeding, then they can do the they can do the fat dissolving injections. The other thing is anyone that has recently given birth, you need to wait for 6 months, and after 6 months then you can carry out the fat dissolving if they're not breastfeeding. When it comes to cancer, if they're currently on radiotherapy, if they are on chemotherapy, you cannot touch them with the injections. They need to wait to finish their round, wait for another 6 months, and then they are okay. Also be careful of areas that have had any types of operation when it comes to treat cancer, as if they want to have the fat dissolving injections pretty close to that same area, you will not be able to actually carry that out. Hormonal diseases, now one of the main ones that you might see is the problems with the thyroid. Most of the time is the underactive thyroid. Is one of the main symptoms of that is the the double chin. If the client is actually on medication for the thyroid, so most of the time that's thyroxine, perfectly fine. They can do the fat dissolving injections. However, if they have been diagnosed with a thyroid disease and they are not on any medication, then unfortunately you cannot carry out the fat dissolving for them. And if they have had the thyroid removed, that is okay as long as it has been at least a year since the operation. Anticoagulants, blood thinners, so this is more so to do with making the product less effective, making the client very prone to bruising. So this is a pre-treatment advice that you need to give to your client, just to avoid anticoagulants, blood thinners and alcohol for 72 hours before the treatment, and that's for any injectable really. Then you have kidney and liver disease. Now this is one of the main ones that you need to consider when it comes to fat dissolving. Kidneys, the reason why it's so essential is when you break down the fat cell and turn it into liquid, you will also use your kidneys to actually flush that out. So if you have had a kidney transplant or you just have one kidney, unfortunately, you cannot carry out the fat dissolving injections. And also any liver disease, you actually use your liver to process all of the solution that you do inject. So any liver disease, unfortunately, you cannot, again, carry out the fat dissolving injections. And then we have HIV, which is obviously a contraindication for any injectable treatment, really. And another blood disorder, which is hemophilia. Hemophilia is when the blood is actually not able to clot correctly, so it will make your product less effective. It will make the client bruise quite a bit. So just consult with your client as to how severe the hemophilia is, if it's really extreme or is it only borderline, and then it's your decision whether you can actually carry out the treatment or not. And then you have diabetes. If the client is on insulin, it's not a problem, but I would just double check with the client when the actual diagnosis of diabetes was, when was their last checkup with their doctor, and what the doctor has actually said, whether they are being controlled and they're healthy, or they're still having issues coming through the diabetes. And then you have water retention. Especially if it's quite severe, where you get swollen ankles, swollen wrists, you cannot carry the fat dissolving injections, as then the liquidified fat cell would not be able to actually flush out. Now, this is also the issue with anyone suffering from lymphedema. Now, this is a disease that just affects the lymphatic system, and it just cannot function properly. So with that, the fat cell again is not being able to flush correctly, so it's a contraindication. And then you also have lipedema. Lipedema is another condition that affects the way that you store your fat cells naturally, so they are abnormally stored. So anyone with kidney, liver disease, water retention, lipedema or lymphedema, these are your main contraindications when it comes to fat dissolving injections. Then how to prevent any other complications from arising is not to overdose the area, especially if you're using an acid-based type of product, as that will actually really increase the acidity within the body, and that will make the person really overwhelmed and really nauseous. And that's also the case with lemon bottle. If you're using quite a lot more than the given maximum by the manufacturer, is the more product you inject, the more product that your liver has to process and go through. So again, it could be quite overwhelming for the actual client. The other thing is to massage the product after injecting. So massaging the product is just making sure that you're spreading the product across, and it's not just into one place, especially if you're using lemon bottle, as you are injecting such large amounts of the product. You do need to massage it quite well after that to really spread it across, and then not to inject too superficially or injecting too deep, because again, too superficially is going into the wrong layer, into the skin, either the epidermis or the dermis, or injecting too deep would actually result in going into muscle tissue and vital organs, and again, that would lead to complications. Also, injecting even amounts of product, make sure that your product is distributed, and you should not repeat the treatment sooner than you should be. So always follow the actual guidelines given to you. And then aftercare advice, avoiding exercise and heat for 48 hours. Again, this is very dependent on the product you're using. If you're doing the chin, the client cannot put makeup on for 24 hours, and they need to know when to actually carry out the lymphatic drainage. And the main thing to actually give your client as aftercare advice is not to take any anti-inflammatory medication for 48 hours, as that would actually stop the fat dissolving solution from working completely, and it will give them no result whatsoever. And the main thing is to carry out the lymphatic drainage massage every day for as long as they can, for at least 7 to 10 days. Then drink a minimum of 1.5 liter water a day. So this is all about draining and flushing the destroyed fat cell. And then if they do have any bruising, they can just apply arnica, and the bruising should normally resolve within 7 to 10 days. And this is everything that you need to know about the fat dissolving injections, and I hope it helps.